Do not take this medication if you or any of your family members have ever had MTC, or if you have something called multiple endocrine neoplasia syndrome type 2, MEN2. Do not take this medication if you've had an allergic reaction to dulaglutide or any of the other ingredients in this medication. The metabolic derangement occurring as a result of insulin deficiency causes hormone-sensitive lipase activity to increase in adipocytes and eventually the generation of free fatty acids from triglyceride breakdown. The fatty acids are beta-oxidized to form acetyl coenzyme A, or CoA, which usually enters the tricarboxylic acid, or TCA, cycle. However, in this situation of absolute insulin deficiency and fatty acid breakdown, the elevated amount of acetyl CoA entering the TCA cycle overwhelms the enzyme systems and is then converted into ketone bodies in the liver. You know when you feel the weight of sadness. You may feel exhausted, hopeless, and anxious. Whatever you do, you feel lonely and don't enjoy the things you once loved. Things just don't feel like they used to. These are some symptoms of depression, a serious medical condition affecting over 20 million Americans. While the cause is unknown, depression may be related to an imbalance of natural chemicals between nerve cells in the brain. Prescription Zoloft works to correct this imbalance. You just shouldn't have to feel this way anymore. Only your doctor can diagnose depression. Zoloft is not for everyone. People taking MAOIs shouldn't take Zoloft. Side effects may include dry mouth, insomnia, sexual side effects, diarrhea, nausea, and sleepiness. Zoloft is not habit-forming. Talk to your doctor about Zoloft, the #1 prescribed brand of its kind. Zoloft. When you know more about what's wrong, you can help make it right. Here's some other self-care tips during chemotherapy. Stay active by walking. Slowly increase how far you go based on how much energy you have. Eat enough protein and calories to keep your weight up. Ask your provider about liquid food supplements that can help you get enough calories and nutrients. Call your doctor if you have any of these symptoms. Signs of infection such as fever, chills, or sweats, severe nausea and vomiting, inability to eat or drink, or extreme weakness. In this example, the lower left quadrant and the lower right are the selected teeth. 3 surfaces of moderate to heavy calculus are verified on the mesial and distal surfaces of number 18 and on the mesial of 31. This fulfills the requirement for 3 surfaces of moderate to heavy calculus on mesials or distals of molars. These are marked in red on this slide. Required calculus is also verified on the mesial of number 20 and the mesial of 21. Added to the verified calculus on the molars. This makes a total of 5 surfaces of required calculus on mesials or distals of posterior teeth. Required calculus is verified on the linguals of 19, 20, and 30.